Hyperalimentation, an overview. Definition: hyperalimentation refers to the process of providing an individual with an excessive or augmented supply of nutrients, either through oral, enteral, or parenteral routes, to meet their nutritional requirements when normal dietary intake is insufficient or impossible. It is often used as a synonym for total parenteral nutrition, TPN, in clinical settings, where nutrients are delivered intravenously. Types of hyperalimentation. 1. Enteral hyperalimentation. Nutrients are delivered directly to the gastrointestinal (GI) tract via feeding tubes. Methods include nasogastric tube, through the nose to the stomach; nasoduodenal jejunal tube, through the nose to the duodenum or jejunum; gastrostomy or jejunostomy tube, surgically placed tubes for long-term feeding. 2. Parenteral hyperalimentation, total parenteral nutrition, TPN. Nutrients are delivered intravenously, bypassing the digestive system entirely. Utilized when the GI tract is non-functional or unsafe to use, e.g., severe bowel obstruction, short bowel syndrome. Indications for hyperalimentation. Hyperalimentation is used when normal oral intake cannot meet the body's nutritional needs due to medical conditions such as severe malnutrition, chronic illnesses, Crohn's disease, ulcerative colitis, or chronic pancreatitis; short bowel syndrome, cancer treatments, patients undergoing chemotherapy or radiation who cannot tolerate oral feeding; critical illnesses, burns, trauma, or sepsis requiring high caloric and nutrient intake; surgical complications, postoperative ileus, bowel resection, or fistulas; congenital disorders like esophageal atresia or metabolic disorders. Components of hyperalimentation. 1. Macronutrients, carbohydrates, typically in the form of dextrose for energy; proteins, as amino acid solutions; fats, delivered as lipid emulsions for caloric density and essential fatty acids. 2. Micronutrients, both water-soluble and fat-soluble; minerals and trace elements, zinc, selenium, copper, and others. 3. Electrolytes, sodium, potassium, magnesium, calcium, and phosphate to maintain fluid and electrolyte balance. 4. Fluids, to ensure adequate hydration. Procedure for parenteral hyperalimentation. 1. Assessment and planning. Evaluate nutritional status, caloric needs, and fluid requirements. Determine the method of administration, peripheral or central venous line. 2. Administration. Use of a central venous catheter, CVC, for TPN, as high concentrations of nutrients can irritate peripheral veins. Regular monitoring of infusion rates and compatibility of nutrients. 3. Monitoring. Frequent lab tests to check blood glucose levels, electrolytes, liver function, and nutrient levels. Adjustment of the composition based on metabolic demands. Complications of hyperalimentation. 1. Metabolic complications, hyperglycemia or hypoglycemia; electrolyte imbalances, e.g. hypokalemia, hypophosphatemia; refeeding syndrome, especially in severely malnourished patients. 2. Infectious complications, catheter-related bloodstream infections, CRBSIs, in TPN, increased risk of sepsis. 3. Mechanical complications, catheter malposition or thrombosis; gastrointestinal complications in enteral feeding, such as diarrhea or aspiration pneumonia. 4. Liver dysfunction, hepatic steatosis or cholestasis due to prolonged TPN use. Advantages: provides essential nutrients when oral or enteral feeding is impossible, prevents malnutrition and its associated complications, supports recovery and healing in critically ill patients. Limitations: requires specialized equipment and expertise, expensive and labor-intensive, potential for severe complications if not monitored properly. Conclusion: hyperalimentation is a life-saving intervention in modern medicine, especially for patients unable to meet their nutritional needs via traditional routes. Proper planning, administration, and monitoring are crucial to maximize its benefits and minimize risks.